Welcome everybody. I am Sarah Hardy Walsh. I'm a naturopathic doctor and lactation consultant in southeastern New Brunswick. And I am so excited today to be here chatting with you about breastfeeding and engorgement. And I have Eryn Matheson from Reconnect Health Center in Moncton, who will be joining us today as well. Let me just see if I can. Eryn, if you're here, if there's an option to request you join. I think, there we go. I am crossing my fingers that the tech is here with us today. Let's see. It is!
Did it work?
Oh,
Hooray!
welcome.
I have bad tech juju, so we never know.
That's right. Oh my goodness. So,
Did it.
yeah, how are you doing today?
Good. How are you doing? It's beautiful out.
Isn't it? Oh,
Yes.
that's wonderful. Yeah. So Eryn and I were chatting recently about the struggles we see breastfeeding families having most commonly, especially early on, and how we could work together to get some more information out to folks in preparation for breastfeeding and in their early breastfeeding journey. And engorgement was one of the topics that really came close to topping the list, because it's something that shows up for families right at the start. Often after they've been discharged from hospital, they're already home. And, you know, a lot of times we work with families that are worried about low milk supply, but more often than not, in those early postpartum days when the body is transitioning from colostrum to mature milk, the body will just make all the milk to get started with things. And so why we're here today is to bring you some information about engorgement and breastfeeding, and to chat a little bit about some different strategies for how to work with it and clear it out so that you're feeling more comfortable and can more easily feed your baby. So welcome, Eryn. I'm so grateful that
Well, thanks
you're joining today.
for having us. I know a lot of people don't know about the role of physio and supporting lactation consultants like yourself. And so our team here at Reconnect is super excited to hopefully, increase awareness that it is something we can help with and make people more comfortable in their postpartum journey.
Absolutely. So let's get started with just a little bit of the basics when it comes to engorgement, so that anybody who's tuning in live or watching the recording, you'll be able to have that information as well. So engorgement is essentially at its most basic an overfilling of the breast tissue. So the milk making tissue just gets really rocking and rolling and fills up the breast tissue and creates sensations of fullness and pressure, and some women describe pain and sensitivity, and that can extend right up into your underarm. Your breast tissue goes right up into your underarm. Sometimes it can, instead of that kind of softer, squishy breast tissue that we're used to, it can get quite hard. Sometimes it impacts the shape of the nipple and can flatten it out, making it more difficult for babies to latch. And because there's so much fullness, that creates some pressure on the milk ducts and can make it really challenging for milk to move out of the breast. And so it can make it difficult for baby to remove milk from the breast if they're latched on. It can make it difficult for you to express milk if you're hand expressing or pumping. And so we really need to kind of take down that swelling in order to move the milk and keep things flowing. And what we want to be careful of is that we are getting things moving and getting things flowing before we're shifting into that state of mastitis. So I know Eryn had popped a question box out to her audience earlier this week, and that was one of the questions is, what about mastitis? When do we have to be aware of that? And so if the milk isn't moving for an extended period of time that can contribute to an environment in the breast that contributes to mastitis, mast related to breast, itis, inflammation. And so when we have symptoms of engorgement, that fullness of the breast tissue and discomfort in combination with things like fever or flu-like symptoms, that's when we're wanting to reach out to our medical care team as soon as possible. But hopefully with these tips and strategies that we'll be chatting about today, will prevent things from getting that far. So there are 2 times that I most commonly see engorgement showing up for breastfeeding families. And Eryn, if there are others that you want to add on, let me know. But the 2 most common times I see are early postpartum, sort of in that transition from making colostrum to making mature milk, before the body gets really used to that process of demand and supply. So mature milk making works on a demand and supply process. Your body makes what baby is drawing from the body. And so, like I said earlier, oftentimes what happens is that the body just makes all the milk. And it takes a little bit of time for that demand and supply process to get underway. So when babies latch and feed or milk is expressed through pumping, then mom's body gets that message, this is how much is needed. And by about that 6-week postpartum mark, that's when we're seeing that demand and supply regulate a little bit more and engorgement happening much less often. Also important to know that engorgement will show up when families are choosing not to breastfeed. So whether that's for medical reasons or personal choice or infant loss, the body will still make the milk, and engorgement can happen. But because in those cases the milk isn't being removed, then production of milk will rapidly decrease. These families also need these tips and strategies when it comes to managing engorgement. So that's the first time that I most often see it, is right early on. The second one is when there are skipped feeds or pumping sessions, and a few different times that this can happen. The first is when baby starts sleeping a little bit longer stretches at night. Oftentimes moms will wake up with really full engorged breasts when that sleep time has been extended. That can also occur with parent-led sleep changes. And so if you're doing some kind of sleep training program that's extending babies' sleep times as well, we can get into a scenario of engorgement. And then the other place with regards to skipped feeding and pumping sessions is the intentional ones when a mom is looking to wean. And so again, whether that's for medical reasons or a return to work, in that situation, what we really want to do is a slow and steady process of weaning whenever possible to prevent the likelihood of engorgement showing up. Are there any times that you can, any other times you can think of, Eryn, where you're tending to see it happening?
Yeah, that was like, I think, a really thorough explanation. The only other one I would add, Sarah, sometimes is when people who are lactating have returned to exercise, for example, and sometimes they're wearing more compressive clothing all of a sudden. So like a sports bra, for example. We have seen like milk stasis after that, especially if they haven't been wearing compressive clothing for quite some time. So that's the only other thing that you haven't mentioned, I think, that we've seen here in clinic.
Okay, that's a really great tip, and something to be aware of as well, whether it's a return to exercise that has you wearing that that compressive clothing, or whether it's with that shift from making colostrum to mature milk, you notice an increase in size of your breasts, but you haven't upsized your bra. And so that can create that similar kind of compression that Eryn mentioned, particularly if it's an underwire bra. We can end up with a lot of milk stasis or stuck milk, behind where the underwire meets your body. Yeah. And so from a feeding perspective, when I'm working with families and we're trying to prevent and manage engorgement, one thing that is really important to remember and understand is to not express milk to soften your breast or nipple before a feeding. So with engorged breast tissue, it can be more difficult to latch your baby. As I mentioned earlier, sometimes the nipple flattens out more, which can level up that difficulty even more. And some common advice that families will encounter is to express some milk or pump some milk to soften that tissue before latching. Remember though, that milk making works on demand and supply. So if we're removing milk from the breast and then latching baby, that's going to give the message to the body to make more milk, which is going to create more engorgement and not often help at all. So it'll help right in that moment to get that baby latched and feeding, but long term it can create some more challenge. So instead, what I usually recommend to families is a process called reverse pressure softening. And so it's just using your fingertips or the edges of your fingers to press just gently backwards around the nipple and areola towards the chest wall. And what that will do is it'll kind of temporarily move that congestion inward so that it softens the nipple and areola. That will help baby latch. And then once baby's latched, some gentle massage of the breast tissue to make sure that that milk is moving as much as possible. You're also going to want to be feeding baby relatively often. Remember, longer stretches between feeds are going to result in an increased likelihood of engorgement in those early days and weeks. Avoid skipping feeds or skipping pumping sessions whenever possible. And then we're really looking at strategies to reduce any kind of inflammation and swelling. And this is where Eryn's tips really come in. So she's going to chat with us a little bit more about using things like heat and cold and massage to really decrease the swelling and inflammation and keep that milk moving from the breast.
Yeah. So I think like your point, so there's a few things that we as physios really focus on in terms of helping move the inflammation out of the breast. And so we know that when we have engorgement or I'm going to say blocked ducts, because I'm going to explain that a little bit more. Sarah has mentioned so beautifully about how when you know we skip feeds or milk isn't being taken from the breast on the schedule that we're used to, it can sit in the breast longer, and that can cause stretching of some of the cells that are in our breast, and that can create inflammation. So what we know now is if we think about a duct, and this is very simplified, but being like a straw, we know sometimes with breast engorgement and blocked ducts that what happens is that the swelling can actually really occur around the duct. And so instead of there being something inside of the duct that's blocking it, it's actually the compression from around the duct that's preventing that milk from flowing freely. And that's when things can get really backed up and swollen really quickly. So managing that, and so the two biggest mistakes I usually see is that people obviously start to feel panicked because they're having trouble latching, they're having discomfort, the milk is not flowing as well as it had been. But the biggest mistake I see people make is that they'll start to very aggressively try to push towards the nipple. Katie lent me her boob too, so I can show on here. And often sometimes they're pushing so hard and aggressively that it actually creates more compression and more swelling around the duct. And so what we're taught is a technique called therapeutic breast massage as physiotherapists. And we really take advantage of what's known as lymphatic drainage. And so lymphatic drainage is basically when you're encouraging swelling to the area that has the largest amount of lymph nodes. And so luckily, for us, we have a large cluster right under our collarbone or our clavicle. And then we also have a really large cluster in our armpit as well. And so when you have any swelling in your breast tissue, taking advantage of that is really, really important. And so what we teach is to think about your breast being like 4 quadrants, okay? When we're working on this side of the breast, okay, we want to really make sure we're encouraging drainage up towards the armpit. And I know that's different than what a lot of people are taught because they're taught to kind of push towards. And so what we encourage is moving that swelling really up towards the armpit to encourage drainage. And if you can lay down on your back and actually get the arm up above the head, that actually allows you to really get up and work into your armpit, because as Dr. Sarah mentioned, we do have milk making tissue in and around our armpit too. So we want to make sure we're treating all the breast tissue as well. Now the inner quadrant, so closer to your sternum and your other breast, when we work that side, we want to work upwards all the way, working right up to the collarbone and the clavicle. And so how we recommend doing that, and you can do this as soon as you start making milk. Sometimes we recommend just doing therapeutic breast massage, you know, maybe once or twice a day, just to encourage good drainage from the breast anyways, and prevent any swelling from kind of accumulating around your ducts. So what we recommend doing is, like, before a feed, if you are concerned about swelling, putting some heat on for 5 or 10 minutes before the feed. Then doing your therapeutic breast massage actually before latching baby. And so as Sarah mentioned, you could do your therapeutic breast massage and then do that really nice technique to help with the actual latch that she mentioned. When you're actually feeding baby, gentle compression, like she mentioned, towards the nipple during the feed, because that will then, once you've moved the swelling out, that'll then encourage to get that milk moving again so that you can empty more effectively. And then once baby is done feeding, that's when you will actually want to put your ice on for 5 or 10 minutes at the end of the feed. So anything cool will work. I know people use those Lanouche, you could throw them in the freezer sometimes, anything, cabbage leaves, anything cold. You want to put that on after you've emptied. So after you fed baby or after a pumping session. And so we have found clinically that that works extremely well. And if we can usually treat the inflammation with that within the first 24 hours of onset, people are usually really feeling a lot better with those manual techniques. And then if things obviously are really, really swollen, sometimes we'll use therapeutic ultrasound, which people might be more familiar with, you know, if they had a shoulder strain or something. But essentially it's the same premise. When you have a small area of inflammation, you can use it effectively to help treat the swelling that's in the area as well. Again, it totally depends on, you know, how acute somebody is or how small or big of an area it is and how we use that ultrasound. But to be honest, Dr. Sarah, the therapeutic breast massage is what really seems to help people get better quickly when they're experiencing inflammation in and around their breast tissue.
Okay, that's great to know. And remember too, so the bulk of those tips that Eryn just provided are ahead of a feed. And sometimes the timing for feeds can be a little bit unpredictable in those early hours and days. So worst comes to worst, you know, if you've got a baby that is saying, feed me now, do that reverse pressure softening, latch baby, gentle massage to move as much milk as possible, and then do those cold compresses that Eryn mentioned. Another thing that I've heard parents use is newborn diapers. They wet them and stick them in the fridge because they have a beautiful
that would work.
kind of shape
that
for
would work very well.
tissue. So if that's needed, you know, you can always use the reverse pressure softening and then the cold compresses afterwards. If you happen to have a little person who's been sleeping for a little while and you're suspecting a feed is on the way, get started with some warm compress or a nice warm shower, and then the massage technique that Eryn mentioned. Like she said, it feels counterintuitive to be massaging up into your underarm and up and around towards your collarbone. But we're wanting to move, remember, that swollen tissue that's pressing on the ducts. So we're not moving milk necessarily in that. We're moving the swelling that's preventing the milk from moving, so that once baby latches or once you're getting started with a pumping session, it's flowing a lot more easily. Yeah. Beautiful.
And a little bit, like a tiny bit is better. You don't feel like you have to spend a huge amount of time, like, because if you do have a hungry, screaming baby, just a few minutes can really, really help. And even if you do that kind of throughout your day, it can make a big difference in 24 hours for sure.
Yeah, absolutely. And the other thing I just thought of too is that if you are finding a comfortable laying down position to do your massage, you can always bring baby up onto your chest on the opposite side and do just a little bit of massage on the side that you're going to latch. and then, and then get moving. And that kind of skin to skin and connection and knowingness that the milk's on the way soon will help keep that little one, calm and easier to latch once you're ready to get going with that.
And
Go ahead.
No, I was just going to say, I know you already made this point, but like, I can't emphasize enough how often when we do see people in clinic with inflammation, that clothing is cutting into them. So, making sure that you do have a good fitting bra, or if you're wearing like a feeding tank top. I know a lot of people like to wear those as well. I always say, do a quick mirror check or get your partner to check for you if you have one, just to see if there's any red indentations. When you take your clothing off or you disrobe, because that is areas where that inflammation will tend to accumulate if there is a lot of compression from clothing. And like, to your point, your body's just changing so much that it's easy to not realize that you're getting compression somewhere.
Exactly. And if you're able to, even while you're home, to go braless, just with a tank top can be easy, makes everything easy access to. I also saw a really wonderful tip from another lactation consultant last week that she had shared from one of her clients, and I will pop it into my stories again after we wrap up here today, and see if I can pop it into the highlights, the breastfeeding highlights as well, because it's a really handy way to secure breast pads if you're really leaking and not wearing a bra when you're home. So it's just a interesting way to shift a big t-shirt around.
Cool.
That, and that would prevent that cutting in, like I say,
Yes.
from the tighter clothing when you're at home. So yeah. Anything else, Eryn, that you wanted to share with folks today about engorgement?
I think that, if you're feeling like you're worried about an area, we're happy. We do our best to get people in as quickly as we can at the clinic, because obviously, as Sarah mentioned, we want to deal with that swelling as early as we can so that it doesn't progress to mastitis or an infection or anything like that. So if anyone is doubting, I mean, obviously come right in and we'll try to get you in as fast as we can, because we do find if we can kind of catch it in that first 24 hours, things resolve fairly easily. And the only other thing I would mention, and I'm sure you've talked about this a lot on your page, is that we do, if we get the opportunity to just screen the infant for oral motor. So we'll just have a look if mom is up for it at like how the mouth and like suck is. And then obviously if we notice anything that might be, contributing to milk not being drawn out of the breast super effectively, that's when we usually make a referral to a lactation consultant, or get them to go back to their lactation consultant so that can be assessed a little bit more thoroughly.
Absolutely. Yeah. That definitely that effectiveness with which baby is drawing milk from the breast is also really important, and I would say tends to play a role when we're seeing the repetition of that engorgement over and over again. So early on is super common, but if it's something that's showing up time and again, definitely it's something that needs to be taken a look at, is that oral function for baby. Wonderful. Anything else?
No, I think that's it.
Wonderful. Well, thank you so much
for
joining me. And I am, for those who are here, I am hoping to save the recording to IGTV. Hopefully I will press all the right buttons when I wrap up here. But if for some reason that doesn't happen, we will make sure to get you all of this information in another way. I hope you are having a most wonderful day. Take care, everybody.
Bye. Thank you.
Bye-bye.